Well, hello, and welcome to the University of Georgia's COVID-19 panel vaccine discussion. I'm Dr. Shelley Nuss, Dean of the Augusta University, University of Georgia Medical Partnership, and I'm speaking to you today from the campus of the University of Georgia. I'm here with the panel of experts to answer frequently asked questions about COVID-19 vaccines, so you can be informed about how they work, why you should get one, and what you need to know after getting a vaccine. All of the panelists here believe that everyone should get the vaccine when eligible, unless your doctors told you not to. The available vaccines are the best way to turn the page on this pandemic, save lives, and begin returning to normal. But we do get it. Many of you have concerns, and this whole pandemic has been complicated and overwhelming for many of you. It's okay to have questions and want more information. It can be difficult sometimes to know how to protect yourself and your family. We hope we can answer your questions and equip you to help yourself and others. Let me introduce you to our panel. Dr. Marcia Davis is Dean of the UGA's College of Public Health. She's an expert on health behaviors and community-based health programs. Dr. John Francis is a physician and infectious disease expert at the Augusta University, University of Georgia Medical Partnership. Dr. Ashley Handings with UGA's College of Pharmacy is an expert on immunizations, including community access to vaccines. And lastly, Dr. Mark Tompkins, a professor at the Center for Vaccines and Immunology in UGA's College of Veterinary Medicine. He's an expert in vaccine development and infectious diseases. So let's get started with today's questions. First, for you, Dr. Francis, why is the COVID-19 vaccine important for a person's health?
Absolutely. So when I think about vaccines and pandemics, it reminds me of history. And as I look back, pandemics been around a long time. You go back to the 1300s, and we had the plague, which ravaged across the world, caused maybe 30 to 60% of actually Europe's population to die, led to 200 million deaths. And you pedal forward and you have trouble also with things like smallpox. And that's when we had the births of vaccines. And we learned about Edward Jenner, who actually taught us that you can use cowpox to protect against smallpox. You come even further, and now we have influenza in 1918, which went worldwide, led to 50 million deaths. Part of the reason why we haven't seen much more pandemics with the flu is because of vaccines. So now we have over 500,000 deaths in the United States from COVID-19, and hope has arrived. The vaccines are here. Now that we have the vaccine, we actually can do something. We can be part of the actual solution. So the vaccines help to decrease symptomatic disease, reduce the risk of having severe illness and death. So that's one of the main reasons we can get a vaccine, protect ourselves, protect our loved ones, because there's something called herd immunity. If I get the vaccine and I come across with someone else that has the disease, I don't bring it home to my family. Herd immunity steps in. There's also something, the more common a disease becomes in the community, the more uncommon manifestations you see. So now we're learning about things like long COVID syndrome or post-COVID syndrome, and we're recognizing even the individuals that thought they had very mild illness can now develop cognitive changes, memory changes, sleep problems, fatigue. People that were marathon runners are now finding it difficult to run, and people that are professors are having difficulty concentrating. So we can actually halt those type of illnesses from happening, whether it's severe in the hospital, mild, or long COVID syndrome. These are the reasons to get vaccinated.
Thank you, Dr. Francis. And just a short follow-up, Dr. Davis, what does the vaccine mean for the public health of communities across our state and nation?
Well, very simply, what it means for communities is that we can return to normal. We can return to being at work. We can return to seeing family and friends. We can return to hugging. Basically, what it means is we can end this pandemic now.
Thank you. So, next question. Several COVID vaccines have been approved at this point in the United States, and more could be on the way. So, Dr. Tompkins, can you share how do they generally work, these COVID vaccines?
So yes, we have 3 vaccines that are now approved for general use in the public, and they work remarkably similarly. In fact, 2 are practically identical. So the Pfizer vaccine and the Moderna vaccine are both what we call mRNA vaccines. And so inside our body, our cells, every cell uses messenger RNA or mRNA to make the proteins that build the cells. And so we have genome to RNA to DNA. Those are the building blocks of life and the steps for how every cell and every being works. The mRNA vaccines take a piece of that mRNA and deliver it inside of you, and now it starts producing one small piece of the coronavirus. With that production of that piece of the coronavirus, it elicits an immune response. You generate antibodies against that protein, and in this case, it's the spike protein, which is critical for the virus. It's what the virus uses to bind to cells to infect them. So you generate antibodies, they bind to the spike protein, and they prevent the virus from infecting the cell. Now, the last vaccine that's approved right now is the Johnson & Johnson vaccine. It's very similar, except it takes a slightly different approach to deliver the genomic information for the spike protein. It uses a recombinant adenovirus. So adenoviruses cause the common cold. There's hundreds of different adenoviruses, and this one they've taken and they've modified it. So one, it actually can't infect and cause disease. It only delivers a piece of genetic information, in this case, the gene for the spike protein again. So you get an injection with the Ad26. It expresses the spike protein, again, a small piece of the virus. You elicit an immune response to the spike protein, and then you have antibodies that will prevent the virus from infecting.
Thank you, Dr. Tompkins. I think also a lot of people are worried about the side effects of the vaccines. So, Dr. Hannings, what are the most common side effects? How long do they typically last? And are any of them serious when people get them?
That's a great question. So, by far the most common side effect that people are seeing with all of these vaccines is pain at the injection site and having a sore arm. And that's not necessarily unique to these vaccines. You get that with any number of vaccines. Now, as far as, how much pain or how sore your arm gets, I have heard some mixed reviews. Some people say it was no different than getting the flu vaccine. With my experience, I got the Moderna vaccine, and I did feel, fairly sore the next day. It was short-lived, so only about a day or so. But I would put it more on the level of getting like a tetanus shot, if anyone listening has gotten one of those before. So you can get soreness at the injection site, usually just lasts for a day or two. Other side effects that you could potentially get could include things like headache, feeling tired, maybe some chills or a low fever. And those also only last about a day or two, and they're really nothing to be concerned about. Those can happen with other vaccines as well. And they tend to be, for the Pfizer and Moderna vaccines in particular, they tend to be more common after your second dose than after your first dose. But those are generally short-lived as well, 1 to 2 days. And serious side effects are very, very rare. I know that kind of scares people because whenever they happen, they tend to get highlighted in the news. And I remember after the Pfizer vaccine got approved, there were a couple cases of something called anaphylaxis, or a serious allergic reaction, and everyone kind of panicked. Those cases are very, very rare. And in fact, I spoke to a colleague the other day who's been involved in immunizing over 40,000 people, and he told me out of all those people, they have had one serious reaction.
Good. Well, that's good news. Well, as a follow-up for Dr. Tompkins, with all these available vaccines, is one really better than the other?
The vaccine that you can get is the best vaccine. Really, all 3 of them are fantastic vaccines. And I know there were concerns about the rapidity with which these vaccines were developed, but they were built upon research that's been going on for over a decade for many of these approaches or longer. And so there's a long history of studying these vaccines, not for the COVID virus, but for viruses and other pathogens in general. And then the work that they did over the past year was really incredibly meticulous. They did not take any shortcuts. What they did do is accelerate the process that would usually take many years. They compressed it all together. They didn't shorten the study times, but usually you would do a study and you would analyze the data, and you might take a year or more before you do the next step. Here, they just did it back to back to back, or even overlapping, to quickly get these vaccines understood and the safety described, as well as the efficacy. So, all three of them are very safe, incredibly efficacious. And when they talk about the percent efficacy, that's where people start thinking, well, this one's 90, this one's 95, this one's only 80%. Well, part of the problem is you can't say, well, 80 and 95 are exactly the same, because when they did the tests and the studies to actually describe the efficacy, they used different endpoints. And so they look at disease severity, or they look at the incidence of infection, or they look at the incidence of hospitalization. They look at very different endpoints. And so when one might have been looking at the incidence of absolute infection versus just severe disease, you're measuring two very different things. And so you can't say that a 95% is better than an 80%, because it's just apples and oranges. So, and even if we could do that comparison and suggest that 80% and 95% are measuring the exact same thing, 80% is still an incredibly effective vaccine. And as was mentioned earlier, these vaccines are safe, and we don't even know really all the side effects that you can get even from a mild case of coronavirus right now. And so we have a safe vaccine that was at least 80% likely to protect you from infection. And you do know that that will work, and you don't know if you get coronavirus. Will you have long COVID? Will you have cognitive issues and other things? And we're only going to be learning those things as the time progresses.
Right. So thank you. So to summarize, so folks really don't need to hold out for the best vaccine. What we know is that they're all extremely efficacious. So thank you. So this one's for Dr. Davis. So it's clear from the data that this virus has disproportionately affected certain groups, especially the Black and Latino communities. So Dr. Davis, what do we know about the reasons for these disparities?
Well, what the pandemic has really highlighted for us is the existing health disparities in Black and Latino communities. These communities have been disproportionately affected by COVID-19, but they're also disproportionately affected for lots of chronic disease, hypertension, diabetes, asthma, that have made COVID more severe for them, causing more hospitalizations and death. And the reasons for higher chronic disease in these populations also have to do with their access to safe housing, to health care, to education, access to healthy foods, and places to be physically active. So all of these factors came together with COVID-19. And particularly with COVID-19, families in the Black and Latino communities live in multi-generational houses. They were our essential workers that could not work remotely, and they had less access to testing. So all of this highlights the need for us to work together to eliminate health disparities in these communities. And that begins with an effort for all of us to help the structural factors that contribute to health disparities. And one of the ways we can do that right now is to make sure that everyone who wants a vaccine can get a vaccine, and we work together with the communities to help, as we're doing, hopefully to give the message that the vaccines are safe for all.
Good. As a follow-up, Dr. Francis, what would you say to individuals in these groups when it comes to getting the vaccine for COVID-19?
Absolutely. The data is not always there, but now the data is present. We can look at the data, and it can be like a call to action. So as an individual that is Black, with friends that are Hispanic and Black, I view this as an opportunity for the communities to recognize try and get the vaccine to the people that need it the most, in addition to making sure that it gets to everyone in the whole country. And so an individual recognizes that they are Black, they're Hispanic, and they recognize their increased risk for disease, for death, they should get vaccinated, be part of the solution. And actually, I think this is a very, very important concept. So there's an actual individual responsibility to be part of the solution, but there's also a community responsibility too. So we heard about access. And so getting the vaccine to where it's needed the most, and this brings in pharmacies, healthcare workers, but also departments of health. But I'm very eager to see vaccines rolled out across pharmacies across the country in rural parts of Georgia, in rural parts of the country, and making it easier for people that are at risk to find access to the actual vaccine. Not everyone can navigate the system, and to get on the internet and to sign up in different places and travel very far. And so the best that we can do to get the vaccine to those that are at risk most, the better. And so I see individual responsibility, I see community responsibility, but I also think about the physicians like myself. As the physicians have an awareness of their population that they actually care for, they need to recognize who am I vaccinating and monitor that to make sure that those who are at highest risks are also coming in to get vaccinated, and if they're not, being proactive to try and encourage them to come in.
Thank you, Dr. Francis. Well, millions of Americans have already been infected and recovered from the COVID virus. Dr. Hannings, should people who have recovered still get the vaccine? Do they have immunity? What do we know at this point?
The short answer is yes. Even if you've been infected with COVID-19 and recovered, you are still a candidate to get the vaccine, and you should consider getting it. So, when we get some kind of disease or illness, typically afterwards we have some level of protection or immunity from getting it again. With some diseases, that might be long-term for your lifetime. With others, even if you've had something once, you could potentially get it again. Because this is still a new virus, we just don't know exactly where it falls on that spectrum. We have some data that indicates that it looks like you're protected for at least a few months, but beyond that, we really don't know. So to make sure that you're protected, even if you've had it before, you should go ahead and consider getting vaccinated.
Great, thank you. Dr. Tompkins, we've heard a lot about the variants coming out with COVID-19. So what do we know at this point about the ability of the vaccines to protect against those known variants?
So that's a fantastic question, and it certainly has raised some concern with the public health communities and with scientists. Viruses mutate. That's one of the things that they do. That's why we have a new flu vaccine distributed every year. The coronavirus may continue to mutate, so we see something like that happening, but we're not seeing that yet. And we're really fortunate. Again, the 3 vaccines we have are really, really good, and the data we have so far suggests that all 3 provide immunity that protects against the variants that we know about today. So, it is not a reason certainly not to get vaccinated, because even if these variants continue to arise and drift away from the vaccine, with certainty they will still provide at least partial protection, if not the perfect protection that we determined when we first licensed the vaccines. And so preventing you from getting hospitalized or preventing you from shedding virus to infect somebody else, even if you do get infected, is still a major benefit from getting vaccinated.
Great, thank you. Well, experts are recommending that we also continue to wear masks and social distance even after the vaccine. Why is that important, Dr. Hannings?
I know that this topic in particular has caused a lot of confusion, and I think it's helpful to think about all of these recommendations as different layers of protection. So, washing your hands, social distancing, wearing a mask, and now getting the vaccine, it has shown to be our most effective layer of protection. But all of these layers of protection work together. And nothing is 100%. Even if the vaccines are really good, there's still a very small chance of potentially getting the virus and spreading it to others. And, we're not really in a place where we can start to take some of those layers of protection away. So in order to get to that point, we really want to achieve something called herd immunity that was mentioned earlier. So to achieve that, we really want the majority of our population to have some level of protection against this particular virus. Well, the last time I checked, less than 15% of the people in the state of Georgia have been fully vaccinated. So we're just not at a point where it's safe to start to take some of those layers of protection away. So we need to continue to mask up. Now, the CDC did recently release some guidance relaxing that a little bit in certain situations. For example, if you are fully vaccinated and you're going to be around others who are fully vaccinated, they do say that you can go without your mask. However, you still need to continue to wear it in public and wear it if you're going to be around a lot of other people who have not been vaccinated, especially if they are at high risk for getting coronavirus or having significant complications from it.
Great, thank you. Well, just as a follow-up, to clarify even further, Dr. Francis, I said some people have been really desperately waiting to see their family and friends for over a year. And so what's your advice now? When will people know when it's safe to finally be around their family, their friends, give their loved one a hug, with or without masks? What do we currently know?
Absolutely. This is where I refer back to the CDC and to national guidelines, and I have that sense of hope that now, once you are vaccinated, as has been mentioned, the CDC is saying that you can get together indoors with others who are also vaccinated. This is a big deal. This is grandparents seeing their grandchildren. This is fathers seeing their sons. And so I believe that now, once you have a cohort of family members, of friends that are vaccinated, they can have a sense of reassurance that they can get together safely according to national guidelines. And I agree, once they're going out in public and they're in places where there may be more larger gatherings of individuals, whether it's a supermarkets or et cetera, then it is appropriate still to go back and put their mask on again, whether or not they're vaccinated, to help ensure that they can be safe outside of their homes.
Great, thank you. Well, listen, finally, a quick parting thought from each of you as our experts. I'm going to give you each about 20 to 30 seconds to give us just your final thoughts on the topic of COVID vaccine. So we're going to start with Dean Davis on the end. What are your thoughts?
Well, this has been, do I say unprecedented again? These have been unprecedented times that we have been living in. And the pandemic is evil. It's not that individuals are wrong or anything like that. It's just we are fighting an evil virus. And it's going to take all of us, as Dr. Francis said. It's us individually, it's us as a community caring about each other to make sure that we get through this pandemic. And we can. There is hope. And one of the big hopes is getting the vaccine and getting everyone vaccinated. And with that, we can help eliminate some of the other things that the pandemic has caused. Social isolation, not being able to be with friends. I haven't seen my grandchildren in a year. I can't wait until I can see them again. We have mental health concerns now. We have chronic disease concerns because individuals have not gone to the hospital. So let's put an end to the pandemic so that we can go on with life with those other important things that we need to attend to.
Thank you. Dr. Tompkins, your thoughts?
Sure. So I'm actually going to follow up on the question about which is the best vaccine. And I said the best one is the one you can get. But then I'd also say that, get the one that, really fits for you as well. So I got the Moderna vaccine because it was available. My wife got the Pfizer because that was the first one she was able to sign up for. My 16-year-old just got the Pfizer because she's 16 and the other two vaccines are only approved for 18 and older, although they are starting to get data and hopefully we'll be able to vaccinate down to 12-year-olds soon. My parents, they got the Johnson & Johnson because my father hates hospitals, he hates pharmacies, he hates needles. He doesn't like any of those things, but he knows it's important to get vaccinated. So he got the one that was only one shot. And so that was the right vaccine for him. So choose the vaccine that's going to suit you and that you can get. And then with that, you'll not only protect yourself, but what has been alluded to earlier, you're going to be protecting others, because there are some people who can't get the vaccine that might be contraindications, or they may get the vaccine and it won't work very well because some populations don't respond as well as others. And we don't fully understand that for these vaccines yet. There are people that are in chemotherapy or immunosuppressive drugs, or pregnant women who are naturally not immunosuppressed, but their immune responses are different. And so now these people, even if they can get vaccinated, the vaccine may not work as well. And these people are at much higher risk of complications. So, choose the best vaccine for yourself, do it for yourself, and do it for your grandparents, your pregnant partner, those people around you in your community.
Great, thank you. Dr. Hannings, your thoughts?
I know that a number of people have been nervous or on the fence about whether or not to get this vaccine with it being so new. I can tell you that I read the studies myself. I attended some of the meetings where the advisory panels met and had these discussions. And after all the research I've done, I can tell you I personally felt very comfortable getting the vaccine myself, recommending it to others, and administering the vaccine to other people. So, if you're thinking about it, I seriously hope that you consider getting it, because it is our key to getting out of this pandemic. And if you're looking for a place, this is brought up earlier, but I'd like to reiterate, as time goes by, there's more and more places that are offering the vaccine. That's health systems, the health department, pharmacies, both chain and independent. So there are more opportunities available. And if you're unsure of where to get it, you can go to the Georgia Department of Health website. They do have a vaccine locator.
Great, thank you. And lastly, Dr. Francis, thoughts?
Absolutely. When I think about the causes of death in 2020, and you recognize the impact that COVID-19 had, it's actually very, very alarming. So 1 out of 10 deaths was caused by COVID-19 in the United States in 2020. It was the third leading cause of death behind heart disease and cancer in our country. So we recognize that we actually have a war on our home turf. This is a war where we live, and we actually have to do something about it. We've heard it come from the highest levels of government that more Americans have died than in World War I, II, Vietnam, 9/11. If you put those all together, it's actually COVID has caused more death than all those horrifying things. This is a war. So we actually have the opportunity now to be part of the solution. By getting vaccinated, we become part of the solution. We can end the war.
Well, thank you. That concludes our time together. I want to thank our University of Georgia panel experts for joining me. More importantly, I want to thank you for taking this opportunity to learn more about the COVID-19 vaccines. We hope you have learned something from our experts, that you can share this information with your family and your friends and other folks who may have questions and reservations about the vaccine. If you have additional questions, as referenced by our crew here, please visit the cdc.gov site. Please take the opportunity to get a COVID-19 vaccine. You're going to protect yourself, your friends, your family, and your community, most importantly. So to schedule your vaccine, there are lots of avenues, as you've heard from our experts. The main primary hub in Georgia is the Georgia Department of Public Health website. It's at dph.georgia.gov, and look for the section entitled COVID-19 Vaccine. Remember, with every person who is vaccinated, our society becomes healthier, safer, and stronger. Thank you so much for participating and listening with us today.